Hello, my name is William Swafford. I'm a physical therapist assistant, and today we are going to talk about the disease called Parkinson's disease. A lot of you may be familiar with it and a lot of you may not be. But today I'm going to talk about the effects it has on the body, the signs and symptoms of Parkinson's disease, and how physical therapy can ultimately help with the patient and help with the disease. There's no cure for Parkinson's disease, but there are treatments that help the quality of life and even the quantity. Parkinson's disease is a neurological degenerative central nervous system disease. It attacks the deep structures of your brain called the basal ganglia, which produce dopamine. Dopamine is the main neurotransmitter that transmits to your muscles for function, for firing of the muscles, and helps with the nerves. So dopamine is very important for your movement, your everyday movement. Parkinson's disease is usually diagnosed between the ages of 50 and 79. Mainly in men, not as much in women, and you very rarely see it in children, but there are special cases. Life expectancy after diagnosis is usually 5 to 15 years. There again, special circumstances. I know an older gentleman, he's 85, he's had Parkinson's for 25 years. He's a special case and has had special surgeries, and I'll get to those in just a little while. I want to go over the four radical signs, the four major signs of someone with possible Parkinson's. Number one is rigidity. Patients with rigidity and Parkinson's are very resistive to passive motion, to any motion. They fight it. Number two, bradykinesia. They have slowness in movement. Everything they do is slow, very slow. It starts getting slower and slower, and the longer they have the disease, the worse they get. Number three, they have tremors. They shake. Usually starts in the hands or the wrists and works its way up and works its way to the other parts of the body. Usually starts on one side and eventually works its way over. And the last, and in physical therapy's standpoint, the most important, is impaired balance. A patient with Parkinson's disease has very poor balance due to their rigidity, their stiffness, their shaking. They fall a lot. So physical therapy comes in and tries to improve balance. Parkinson's is non-curable, so we just try to help with the strengthening and the quality and quantity of the life of the person with Parkinson's disease. Physical therapy's main functions in a person's life with Parkinson's is to keep them strong, to help them with everyday activities, because everything begins to get harder. When a person with Parkinson's, what they do is they freeze a lot. They get stuck. What we do is we'll shift their weight side to side and hum a song to them, and it snaps them out of that freeze. They freeze in doorways and across transitions from carpet to tile or anything like that, steps, anything like that, they freeze. So the caregiver can just shift their weight side to side and hum that person their favorite song. Number two is they have a festinating gait, which is short shuffled steps, and they tend to crouch over as they're walking. Very dangerous. They can fall. Everything, their back starts to hurt. Just all kinds of problems arise from that type of gait. So what we tell them to do is we'll tell Mr. Smith, please take the biggest step you can take. And once they do that, it's usually about a normal stride that they take, but they think it's huge. There's no cure for Parkinson's. However, there are surgeries, there are medicines. The surgeries include fat cell transplants, stem cell transplants. You hardly ever see and hear of those for obvious reasons. But the main one that I've seen, I've actually been able to work with a gentleman I spoke about earlier who's had Parkinson's for 25 years. He has a deep brain stimulator, and it just stimulates the brain every so often, and it helps him, and it starts to decline. His body gets used to it as the disease goes on, and he has to go get it recharged. And there's always medications, and usually that's what people get is the medication. So in conclusion, I just want to reiterate what I said a little while ago. Patients with Parkinson's, it's non-curable, usually between 50 and 79. They're very tight with movement, they're slow with movement, they have tremors, and they fall a lot with impaired balance. Their eating habits become worse. They're losing weight because it becomes hard to swallow. It eventually becomes hard to breathe. So a patient with Parkinson's disease debilitates very quickly. And physical therapy is a main key in a person's life, helping them keep them strong focusing on strength training, balance training, and safety awareness, along with getting a dietitian in there to help them with food and eating and getting the nutrients they need to help with the therapy, because if you don't eat right, it's hard to gain strength. I want to thank you for your time, and we'll talk to you soon. Thank you.